hospitals told to fully activate their emergency plans to try to handle the surge in coronavirus cases.
And Steve, our state's ability or inability to do so has massive implications. ABC 15's Zach Crenshaw joins us live now. And Zach, you actually spoke with one of the people who helped draft that plan.
Yeah, he helped craft the 140-page plan years ago, well before COVID-19 upended our world. But now that plan is being activated. Its goal to help the patients and doctors and nurses like the ones behind me at Banner University who are running around a packed COVID ICU. It's not a number state leaders wanted to see.
As of today, we had about 23% of ICU beds reported available across the state.
That means more than 3/4 of Arizona's ICU beds are in use. Banner Health tweeting, since May 15th, ventilated COVID-19 patients have quadrupled.
We have had a continual rise in cases over the last several weeks.
That's led Dr. Kara Christ and the Department of Health Services to once again urge hospitals to activate the emergency plan.
What you're really starting to see now is a realistic assessment and checkup of, are we actually ready for a sort of upsurge of COVID-related cases?
ASU law professor James Hodge is a contributor to Arizona's Crisis Standards of Care plan.
It's that we're going to do the best we can with the resources, beds, and available personnel that we have.
For state health leaders, that means potentially using resurrected field hospitals like St. Luke's. The state also directing hospitals to use the surge line.
So we've seen people transferred from rural parts of the state so they could get that higher level of care.
As the cases grow, Governor Doug Ducey continues to search for
a sustainable strategy for how to balance the economic impacts and the public health risks.
While the economy is slowly coming back to life, COVID is rapidly spreading, with large protests and everyday gatherings at work and restaurants potentially worsening the situation.
And not just the protests, but gosh, do you know where we'll be in about 6 weeks? Time to reconsider opening schools again.
Whether schools reopen and businesses stay open depends largely on the next month and the emergency plan now in place.
It's going to be a very interesting summer of COVID. Every Arizonan should take their risks seriously.
Now, important to note, the governor has acknowledged in his press conferences that reopening was going to lead to more cases. He said his focus, though, has been buying hospitals more time so they can handle any and all future cases. Katie, if this trend continues, though, that's proven to be a very difficult task for these hospitals.